Hi, my name is Steve Holloway, and I'm Director of the Primary Care Office. Under statute, our office is charged with three primary functions. The first is the assessment of health professional workforce needs throughout Colorado. The second is to support policy formation that improves access to care for underserved communities. And the third is to administer health professional practice incentives that draw clinicians into areas of underservice. Our research interest in the All Payer Claims database is with regard to primary care claims analysis. A problem that we address is understanding how access to care is different based on geography throughout the state. Traditionally, we have applied a federal methodology that has been in place since 1977, which tends to prefer service areas that are constructed based upon municipal boundaries such as county lines. In the absence of other kinds of analytical information, counties might sometimes, at least on its surface, seem like an effective approach to creating service areas. On the other hand, I think few of us have ever considered a county boundary when determining where we and our families would receive care. I'm going to share a map with you to explain what I mean. This map was created using all 2021 primary care claims in the state of Colorado. Our objective here was to better understand how people's choices for primary care at the individual level color a service area map that represents something closer to how people actually acquire care as opposed to simply relying upon county boundaries. The origin destination model is fairly simple in its construction. We look at the origin of the patient, that is where they reside, and the destination of care, that is where they receive primary health services. When creating this duplet over hundreds of millions of claims, we see patterns emerge in the data that indicates a service area. To illustrate, I'll draw your attention to the Four Corners area. In Montezuma County, if you are familiar with that county, you'll know that the town of Cortez is roughly in the center. It is the largest community in Montezuma County, and as such, it's the logical place for people to acquire primary health services. What you'll notice, however, is that the color of Montezuma County is shared with Dolores County and western San Miguel County. What this indicates to us is that the preponderance of people who live in Dolores County and western San Miguel County also elect to receive their primary health services in the town of Cortez. This is important because traditional models might have split off Dolores and San Miguel County from Montezuma County, which isn't actually a reality that we observe in the data. Furthermore, we might have made the mistake of putting San Miguel County into a single service area. Now, this perhaps makes some sense if we are unaware of some of the characteristics of that community, but it makes less sense when we come to appreciate that the eastern part of San Miguel County, Telluride, is culturally, economically, and socially quite different from western San Miguel County, which is much more likely to be agricultural. Furthermore, it wouldn't make a whole lot of sense for the majority of people in western San Miguel County to transit east up into the San Juan Mountains to receive primary health services, but instead elect to go on the north-south highway into Cortez to receive their care. As somebody at the state who is charged with resource allocation, we reveal more important information about these communities by evaluating the claims so that when we are determining which communities could benefit most from limited public resources, we consider western San Miguel, Dolores, and Montezuma together as a single service area. There are other parts of the state where counties are indeed reasonable service areas, like that you see in Custer, Huerfano, and Los Animas County in south central Colorado. But most other parts of the state, the picture is much more nuanced. Another example of that nuance occurs in Crowley, Otero, and Bent County. Based upon the primary care claims data, we know that La Junta is the center of care for those three communities, that if you live in Bent, Otero, or Crowley, more likely than not, you are choosing La Junta for your primary health services needs. But if you look closely, you'll notice that the northwest corner of Otero County is actually shaded purple, similar to southern Pueblo County. What that indicates to us is that if you live in the town of Haxton, you are more likely to select Pueblo as your primary care provider than La Junta. Again, this gives us important nuance when we're making decisions about access to care resource allocations for that part of the state. When we remove the county boundary layer, we can see that counties are much less prominent in the way that people acquire primary care. Now, you may be asking, is there more utility in this mapping process than simply allowing us to determine where Colorado Health Service Corps providers could best improve access to care in Colorado? The answer is a resounding yes. Because we build these service areas up from census tracts, it gives us essential demographic information at the community level that allows us to effectively create a social determinants of primary health score for each of the service areas that you see here. In other words, we can look at communities' characteristics based on poverty, income, insurance status, unemployment status, number of minor children per household, and make predictions about both the demand for primary health services and the likely barriers experienced by families in each of those service areas that are related to more social characteristics. Those service areas that have the highest index of social determinants needs is another example of ways that we can more effectively target resources to those communities that would benefit from our resources most. Also, because this is a claims analysis, we can evaluate ambulatory care sensitive conditions by service area. If you are familiar with ambulatory care sensitive conditions, you know that those are the kinds of claims that tend to show up with greater frequency in emergency departments within communities that have higher barriers to primary care access. Things like poorly managed type 2 diabetes. By scoring each individual service area according to its ambulatory care sensitive conditions, we can again see with greater detail which communities are experiencing the highest barriers to primary care and be able to specifically invest almost down to the address in communities that would benefit most from those added resources. Together with our health professional shortage area analysis, we will see with greater resolution the needs of communities. Another attribute of this map is that it is currently all claims and all primary care clinicians. The next step in analysis is to look at Medicaid enrolled clinicians and Medicaid eligible populations. We would anticipate that this map will change somewhat because people with public insurance have more constrained access to primary care services in their communities. That will again inform decisions we make at the state about how to determine where best to assign primary care access building resources in the state. This map gives us even greater detail into service areas in our most dense part of Colorado. As you can see, the Denver metro area is many service areas in a sort of mosaic. What you don't see is organization by county line. For example, we can see that South and Eastern Denver is more similar to Aurora in terms of a service area pattern. The west side of Denver itself is its own service area pattern. If you are familiar with the demographics of that part of the city, you'll know that some of our lower income neighborhoods are in that area, and those neighborhoods tend to be more ethnically diverse. You can also see in that hot pink there areas of greater affluence in Denver, and again, an organization of primary care access that is more associated with higher income communities and insured people. As you can see, this analysis reveals a level of nuance that has never before been possible. In combination with income data, social determinants data, ambulatory care sensitive conditions, claims level analysis, and workforce capacity, we have new potential to determine exactly which parts of the state would most benefit from resources intended to improve access to care and reduce health inequality. We are excited about the analytical potential of this work. We know that it will better inform our choices for whom to support in improving access to care for underserved communities in Colorado. We are also eager to share this research with partner organizations that have a like mission and endeavor to reduce health inequity in Colorado. I look forward to your questions, your comments, and your feedback. Thank you.